And, healthcare startups face more challenges on the path to success than typical companies. Regulatory requirements, technology changes, adoption hurdles are all exacerbated by the nature of the health sector. Navigating the obstacles is often contingent on getting the right advice, introductions, and exposure. So supporting startups isn't just about teaching them, but sometimes it's about a direct form of assistance from experts. By sharing our connections among a trusted coterie of partners, we seek to smooth out the way around some of these impediments and promote a more efficient innovation ecosystem. We're going to begin this session with Kate Berman. She's a program manager of Kids X from the Children's Hospital in Los Angeles. And so, Kate, I'm going to bring you on if you don't mind just taking a minute if you want to introduce yourself.
Yeah, hi, welcome, everybody. Thanks for having me. I'm super excited to be here. I think what you said, Jennifer, about connections between people is something that we do at KidsX really well. So just to give a little bit of background, I've been with the KidsX team for this whole past year. We built this international pediatric accelerator program from scratch that's focused on advancing innovative solution that solves the most pressing problems faced by health systems across the globe. And our goal to achieve that is through collaboration, cross-sectional stakeholder collaboration, investment in the space, and of course through education and networking opportunities that gather all these people together. My background prior to running the accelerator programs was doing consulting for health systems, typically inside out innovation, so what we called employee-led innovation, taking those ideas from back of the napkin to actually building out business cases and growing those products and bringing them to market. And then prior to that, I was more true to my public health background roots, doing a lot of nutrition education and local food ecosystem work in Chicago public schools before moving out west.
It's good to just have that whole background, and especially obviously with the work you've been doing with KidsX, that certainly ties into what we've asked you to share, which is working with hospital systems. Obviously, there can be challenges and there's also huge opportunities. So maybe if you want to highlight some of the challenges that you see with startups working with it and what might be some of the suggestions you have on how they could address that.
Yeah, there's definitely a lot of challenges. I think most of the challenges lie in kind of what I call like root cause infrastructure issues, which I think the whole health system is subject to, but primarily, I think the speed at which startups are ready to get their products in the hands of patients and families to directly impact care, and the logistical, legal hurdles and risk hurdles that health systems have to actually get those products into even a test environment for their patients and families can create a little frustration and friction where there'll be a lot of momentum on the identified problem area and the solutions that are ready to be deployed. But then from, an integration or risk perspective, it just takes often weeks to months for that to happen. So kind of keeping those relationship momentums alive while startups are perhaps, running out of funding or needing to demonstrate outcomes in order to secure a next round or a next clearance level can definitely be a huge challenge. I think also, we at KidsX take a very both a problem-centered and champion-centered approach, because we know obviously that solutions looking for a problem typically aren't going to succeed. Whereas if the health system stakeholders and system as a whole are hungry and eager to address a certain key priority area, or their patients are, the problem is urgent and widespread of their organization, they're going to be more incentivized to throw time, money, and effort towards a problem. But we at KidsX also have, designated champions that are both at the executive C-suite level, paired with, if relevant to the solution, actual provider, nurse, or champion that would be deploying it on a unit. Because if the people, the end users of the product aren't engaged, in addition to the people who are making decisions about purchasing aren't all bought in and in alignment on it, the project isn't going to go very far. So yeah, that's just a start, and I'll stop there.
That's all right. I think everybody would be fascinated to hear more about it because, frankly, as you point out rightly, a lot of these startups, their dream, their product, like at the end of the day, the only way they're going to succeed is to be able to sell into the hospital system. And yet, you from the inside have probably seen even worse from them from the outside of what that bureaucratic wall can look like when the answer is you just can't get there from here, right?
Exactly.
The answer is just no. It's like, this is just not something that happens. So tell me a little bit about your experience at Kids X with the Children's Hospital of LA and some of the walls you ran into there and maybe how you managed to climb over them or go around them. Like, what was something that frustrated you coming from Chicago and being transferred in? I don't want you to talk smack about your employer entirely, but give me an example of something that was a problem that you had to solve yourself.
Yeah. So I think what's funny just about the forming connections piece of this, especially in both a virtual climate and a COVID climate, even health system cybersecurity alone has really doubled down in the past year, and rightfully so. But even trying to get our health system stakeholders to communicate with one another and startups to be sending them information back and forth, that's like a silly administrative barrier. But so many things were just blocked, or people weren't receiving information in a timely manner, or they had to talk to a million IT people just to get information through. So that's like a silly friction point, but just to
that's
highlight.
Not silly at all. In fact, we just ran into it literally at our first speaker today. Dr. Jeff Cohen had a problem with the firewall because our emails weren't getting through to him. And so we had to go around it through our private email in order to get to his private email to have him log back in. So
yeah, so that's been a big learning to get, different health system stakeholders. They're eager to work together, but we've had to do like several iterations of workarounds, platforms, conversation channels, etc., just to make sure that everybody is able to receive information in the way that their systems allow for, and in a timely manner, and in a way that's preferred for them. So I think there's like a huge piece on almost like change management, as well as just like how to get information to people at the right time. That's been a big barrier that we just honestly have to keep iterating on and learning from as we go. Like I said, we launched this program a year ago. So we ourselves almost operate like a startup where we do little sprints and then take information based on the feedback and the, hurdles we overcome. And then we have to adjust from there.
Well, apparently you're doing something right, because I believe you guys just received a partnership with AWS. Is that right? To work on some new projects?
Yeah, we're actually super excited.
Solve your email problem. Maybe they can save you.
Honestly, yeah. So just to give everybody in the audience who may not be familiar, so Kids X is a pediatric-focused accelerator. We had about 13 early-stage companies in our first cohort, but this summer AWS reached out and said, "Hey, we want you to run our first AWS healthcare-focused accelerator, which is a 4-week business and technical mentorship program for companies that are actually poised for growth." So they have products that have been somewhat tested and validated already in the market, and they are looking for health system partnerships and connections, as well as the AWS technical support to figure out how to set their technical infrastructure up for further success and growth. So we launched week 1 actually Thursday on Monday. So we've had an awesome first week with 10 startups, which we'll announce publicly next week. And then just talking through connections, we've had already, today we had all of our startups in front of our Kids X pediatric members, and we'll continue to put them in front of our investor network, our payer network, et cetera, because obviously we believe in cross stakeholder collaboration and making sure incentives are aligned across the different stakeholders.
So are you looking to send your net out there for some more digital startups so you can increase the audience you can show to your new AWS benefactors?
Definitely. Yeah. Well, from a Kids X perspective, we'll be launching our year 2 applications in November after what we call Problem Identification Day. So we gather all of our pediatric health systems in a room and we talk through what are your most pressing problem areas. And last year we got over 300. So that just gives you a breath of some of the pain points that exist in the health system. But what's actually really interesting about the aggregation of that is, although we talk about, when you work with one health system, you work with one health system, or even within a system, one facility or one department. But at the end of the day, maybe I'm altruistic or I'm optimistic in thinking this, but I do believe that all of the health systems truly want the same, positive outcomes for their patients and families and communities, as well as have a lot of the same friction points. Just the way that it's able to be addressed and the speed at which it's addressed is different based on obviously state and leadership, etc. So it's interesting to find common ground, and we've heard that from our chief innovation officers of it's so refreshing to be amongst peers that we can be on the same page about our dreams and visions we're trying to achieve, and then creative ways of how we're approaching solving them.
Kate, can you tell me, sorry, I joined a little bit late. Great to see you again. I, if you recall, was a mentor for your first Kids X program, and it was fantastic to be involved. But I just have a couple questions. Remind me how many health systems you were able to bring together for Kids X initially.
Yeah, so our initial year, we had about, I'd say 42 was the number. I'd say about 35 were super actively engaged, what I call actively engaged. So directly meeting with startups, trying to plan a pilot, etc. Actually, we'll be publishing this soon, but we have 6 pilots that have been launched from that first program, which ended in June. And then we have 20 unique member organizations that are still finalizing their pilot contracts, with another estimate of like actually 20 of that being launched over the next, hopefully 3 months, which has been great. We of course were hoping for a little bit earlier launch, but you know, it's a learning for us to realize the actual length of time it takes, especially for earlier stage companies, to get contracts.
And it's healthcare. We have to remember it's healthcare. Like, it always takes longer than you think it will. But the thing that I think is so impressive is just not only the number of health systems you were able to bring together, but being a mentor for one of the companies, they essentially had 3 pilot offers. So how were you able to, I think, get those health systems as engaged as they were to really partner with these early stage startups? Because I think that's the key. And at least from the company that I mentored, like, not only was this, pilot, like, so they were setting up for a pilot, but they were already in discussions of what's next. After the pilot, what does the contract look like? How do we really, get to the sale in the end? So I'd love to hear your thoughts on that.
Yeah, well, I guess I'll speak to 3 things on that of how we got them engaged. I think one, like I said, was the problem-centered approach. So they were telling us, like, these are problems that we have buy-in and money and time that we want to solve for. And so I think by us, our team doing the bulk of the vetting and getting really quality startups, both from a team perspective and a market penetration perspective in front of these systems, they already were a little bit bought in from that perspective, with both the stakeholder side, having champions that said we're committed to this, as well as from the problem identification side. I think the second piece that a program like Kids X, or really probably any accelerator, offers is structure and peer pressure. And so, all of the systems are like, oh, why does Boston Children's already have a pilot with this company and we don't yet? And so getting them actually in the same room, it was really fun to have. We have a system on the West Coast that's like super early stage. Everything we were putting in front of them, they were like, you are helping us build our infrastructure for this. We don't have anything. Of course, Boston Children's pretty much could write their own playbook, and they have, about how to run a program like this.
Right.
So it was really great to see, them really actually like be engaged in helping each other out. I think healthcare gets a bad rep for, the competition and secrecy that it creates. But I think a program like Kids X both has the peer pressure component of like, oh, I want to be like them, while also having this collaborative environment where it's safe and fun, hopefully to both vent and also inspire change. So I think those are the main things. And then lastly, I'll say I think our team can provide some almost like the project management or the structural nudges, where we interviewed all of our systems about what their innovation process looks like, and sort of have started to put together best practice of what are the key information each stakeholder needs to come to the table with in order to make these, the short time that they have together, very fruitful and actionable. Maybe I'm like such a consultant where I'm always like, okay, what are the next steps? Let's get it done. So having somebody be a force of nudging, I think, can help with the human behavior challenges that exist.
Yeah. First of all, I love what you're talking about from a collaborative perspective. From the health systems, clearly part of the alpha partnership is really to bring together accelerators and those that support startups, really to generate that same type of environment, because as you have shown already, it's so important. And I have to give you a lot of kudos. You guys, for the first Accelerator, and to be a part of it was very cool. And I thought you guys did an amazing job, and we're always so open to feedback. And it sounds like from every stakeholder. So I just want to say congratulations and thank you for being here today, for telling us all about it, because you guys have done an amazing job.
Thank you for having us and having been part of that first program. It's been such a joy to work with both you and also Michael, who I spoke with yesterday and told him it was the best conversation of the week. So I'm really inspired
I love
by
it.
what you all doing too. Thank you.
It was
Fantastic.
only Wednesday. It was only Wednesday. Still have 2 more days.
Still stands.
2 more days to have better conversations than that. But yeah, that was great. Thanks so much. Kate. After I have a conversation with one of my good friends, David Ochee. Now, Dave was one of the inspirations for why I started the Alpha Partners. And the reason was that he and I had a conversation that was supposed to be 45 minutes long, ended up going over nearly 2 hours, and we basically both wanted to go grab a couple of beers and just sit back and chat over Zoom. So it's a good thing we're not in the same city, Dave, or else we'd be drunk every night.
Pretty close.
So, yeah. So Dave basically has worked in a number of different Innovation Hub programs, and he saw the CS Irvine system from the inside out. You're one of the consultants for San Diego, right? As well as the executive director of Domingo Hills. Do I have that right?
I'll just take it all.
Yeah, well, you kind of do it all, so why not take it all? So that's great. Anyway, the result of that conversation was a series of best practices that I'd written down, that I worked on, that I then communicated to a few other people. Mike Phillips, who will be joining us from Intermountain after we have a conversation about the Mentor Roundtable. He also has contributed. I'm just seeing here off the corner of my screen. I don't want to give him slack. But so Dave, one of the things that we talked about when we were working through all of this was the need to really engage and have a deep mentor bench. Right. So what do you mean by a mentor bench? What is that like? I know what mentors are, but what do you need a bench of them for?
Yeah, well, first of all, thanks for inviting me to this. It's been a blast in the hour and a half or whatever we've been going at this. I love the shotgun approach, so I'll be brief. My background has been, at least over the last 8 years, has been in public education, right, at higher education at UC Irvine and now at Cal State Dominguez Hills. And mentor networks are, these volunteer networks we rely on in incubators and accelerators and entrepreneur programs that drive the expertise that we need. And one of the challenges we find, especially in public institutions, is this fear of commingling private investment and private interests with public state funds. There's very reasonable and valid reasons that we are concerned about that. At the same time, it's limiting because if I have a Michael Schmansky who can give phenomenal information about funding and resources and networks and everything, but says, hey, I want to come on board and be a board member, a board of advisor, some sort of compensated role beyond being a nice volunteer, consultant, anything. There's this hesitancy, if nothing else, to draw a line and say, no, you're going to be above and beyond. This is now a hunting expedition for you to get consulting contracts, and that's not what we're here for. And so there's this protection mechanism, and that's legit, and there's value to that, and there are certainly people who will abuse the system if it goes otherwise. But I believe in a bench concept where there are maybe people where it's only philanthropic and it's just, hey, I want to give back, to the community and to upcoming entrepreneurs and that sort of thing. But there's also a value to having a pathway that is reasonable and accessible for teams to be able to engage with a mentor network beyond just being a mentor, right?
Yeah,
whether that's a consultant's board, whatever it is.
So you're saying it's not scary to have these guys that want to be basically economically involved. It's just that you have to manage them properly.
Well, you have to keep the expectations reasonable. And my approach and what I advocate a lot for is having the access for people to be able to get free mentoring or access to mentors in a reasonable way for a startup. But then if the relationship's going to change, become an advocate, not so much for the mentor. They're usually grown up enough to be able to take care of themselves, but go sit on the side of the entrepreneur and help them understand this change in relationship with the mentor will mean the following things. It's now outside these agreements we had with our mentors. You're engaging in a contract. Do you understand what that means? Do you understand what this equity is? And it becomes an advocate for them to make sure they understand what they're getting into. But then ultimately it's up to them. And what I found is if we think of mentors as not just being a mentor, a coach, short-term or long-term kind of thing, but instead say they can be investors, they can be connectors, they can be interim CXO roles, they can be long-term co-founders. I mean, they could do all sorts of things for a team. And for us to say, well, our mentor network does X, Y, and Z, and that's it, is horribly limiting. It's better to say, well, maybe they start with X, Y, and Z, and then we go through the rest of the alphabet, but we don't manage the rest of the alphabet. We just help make sure that you're going in eyes wide open. And the other thing to keep in mind is many people build an investor, or excuse me, a mentor network based upon what they think their classic persona company coming through is going to need. Well, that's great, except that persona, even if you get 100% that come in under that persona, which doesn't usually happen, right? It's hard to do that. It changes over time. What they needed at the beginning of the cohort is different. What they need at the end is different. What they might need 6 or 12 months after your cohort, where you can still be creating value through a mentor network and
so there's a few elements here that I want to hit on and wrap it into our last question, and that's that before our roundtable, and that's that. Okay, so what I'm hearing is it's important for you to advocate for your startups over your mentors. It's important to have a flexible mentor pool that isn't always looking out for just the money side, but that they actually want to be intellectually engaged, as it were. They want to be involved in the pool, right? But it's also important to actually be able to know what your startups need. Then there's a lot of work involved in this, right? I mean, this is not like an easy thing. So now you're asking for yourself to get compensated to essentially be their agent against the pool, right? So how do you balance that? I mean, there's a lot of resources that this is going to take in order to manage that pool if you're going to do it well.
Yeah, but that's part of, just like an accelerator program has to have programming on, proper incorporation and proper clinical trial pathways. You got to pull an expert in to do that. And usually a program manager, a cohort director, whatever, the title might be, should know enough about where the team is at. And if they're not, it's a great role for a mentor to take. Right? And they understand it, and they're a lead mentor, and they say, look, you really need 3 types of people in here now, and you're going to need in 6 months these kinds of people. And build, I mean, I'm a big fan, no one ever does it, but I'm a big fan of a thing called a mentor roadmap. We have product roadmaps. Why don't we have mentor roadmaps? I don't need an FDA consultant today, but if we hit our targets in 6 months, I'm going to need these certain kinds of consultants or experts that can help me create a mentor roadmap, even start making introductions before it's needed.
An excellent point, because now if you've laid out the actual layers or the points at which different mentor type skill roles are needed, you can actually say, well, stay involved with this company. At this point, you could get compensated. At this point, you could get compensated. These are the places where I'm comfortable with you coming in as a consultancy role and getting paid for your services, because that's the specialty point. But don't try overselling your side of the network before we've reached that point as the startup.
Exactly.
So, again, we're getting back to one of our favorite themes between David and I is like creating a transparent and direct framework. Some like not necessarily strictly algorithmically based, but something that at least sets expectations ahead of time, so that we can set these. What'd you call them, David? Signposts in the road, essentially.
Basically,
specific, not milestones that they hit. Well, that's a great way for us to now trend into our larger roundtable conversation. And this is with Kate Berman, who you guys have met previously with the excellent work they did at KidsX. And now I'm going to bring in Mike Phillips as well from Intermountain Ventures. So Intermountain was one of the other legs of the stool, so to speak, legs of the table that made me want to build out the Alpha Network. And that's because they had a very different framework of how they vet companies, how they invest in companies, but importantly, how they push companies into success. And they've had tremendous success in driving success. And with that, Mike, maybe just describe to you, the audience, your business model at Intermountain as a way to kind of start the conversation for those that don't know.
Hey, Michael, my audio is not working very well from the standpoint of being able to hear you. So that's why the delay. Can talk a little bit about our business model. I'm getting texts from Jennifer about what I'm supposed to talk about. So I'm going to give it a shot. So I'm one of the partners for Intermountain Ventures, and our model at Intermountain Ventures, and actually we've been working with the KidsX folks, so it's been an awesome relationship. We have a couple of their companies who are going to come into work at Primary Children, so good stuff for our patients. So our primary model is to be able to bring good companies to Intermountain to be able to make our care profile better, to be able to do as best job as we can to make our patients healthy. We do that by bringing in companies and piloting through our venture group, and we make investments as well. We primarily invest in companies that we use inside our health system, and we do a lot more than that in the sense of just the investment. So when we pilot stuff, we have a special group inside Ventures who just does pilots for us. They help navigate our health system for small companies, which can be really difficult. So the IRB, compliance, legal, IT, all of that stuff, we help navigate that, and we bring the product to the floor so that it can be piloted with our frontline caregivers. And we build a business case around it because Intermountain is an at-risk health system. So about 65% of our revenue comes from full risk. So what we will do when we bring a company in is not only show how effective it is on the floor, but show how it changed our business model and created value for the health system. So oftentimes when we do pilots, we'll take warrants in return for some of the pilot work, and then we usually do a follow-on investment if things go well. So that's our sort of basic thesis. And the thought process behind it for us is that for years and years, health systems have gone ahead and done pilots, and they've gotten great clinical services out of this, but oftentimes they've made companies much more valuable in that point. And that's a value that we would like to return to our patients. So we're a not-for-profit organization, and if that company does really well and we're invested, we're going to take the proceeds from that investment and put it back into more patient care. So it's really a model to be able to get people on the floor to get the best technology possible, make our patients healthy, and take the money that we'll earn from that and put it back into more patient care. So I'm assuming from your nods that's reasonably okay, because I can't hear a thing.
One of the things that I thought was really interesting about Intermountain's model was that they use a champion model. So they find a clinician in network to almost become the champion of vetting that product. And then they go back and they ask that touch point, how successful was this in getting into your workflow and in solving the problems you have, and that they become the rep in some ways.
Yes. So a big part of what we do and a big part of our model is that before we invest in someone, we'll always establish a clinical champion on the floor who's going to help us make sure that this happens. So one of the things where we found in the past, companies have broken down when they've gone into a health system is that they haven't got that boots on the ground person who really wants this to happen, who will be not only an apostle in the system, but one that will talk to folks on the outside after they've had a great success with the company. And they're usually the kind of person who is their early adopter kind of folks. They see an opportunity to make patient care better, and they're incredibly enthused about making that happen. So we go ahead and try and find those people for the company and match them up with really enthusiastic people on the floor. We also have a way to pay those people for their time through our ventures group. So it's not an issue where people are deciding whether they can do their clinical work or participate with the study. Most of the stuff we use, they'll be using during their clinical work. What we do pay them for is to meet with the company, to make sure that they can give them feedback, and to help facilitate the process of talking to other hospitals where they might be able to use the product, and also the sort of standard academic writing papers, presenting at meetings, those kind of things. But we found that if you don't have someone who is really, really a proponent of the company, there's no way to force it to do well inside the organization.
One of the things that we've experienced at Angel MD is something similar, where we found that one of the great values of the clinical network is our ability to match doctor champions or representatives as advisors to those companies. Now, Dave, you talked earlier about the mentor bench. A lot of what you were addressing was much more business oriented or operations oriented. How important have you found developing a scientific mentor network? Is that something that you're able to do as an individual group, or is that difficult for you?
It's always hard because science is so specialized, right? I mean, we had one project we were working on where they were dealing with EEGs, and we just kept digging deeper and deeper as to the kind of specialist that was needed in it. And I finally, at one point, threw my hands up and said, okay, go tell me who the right 10 people are in the country, and I'll just start cold calling, right? And she could only come up with a list of 6. Because there were only 6 people that really fit the niche really well, that were really, market leaders in that. And that's really hard to build. And that's where I think a more universal approach, I mean, any one program creating a mentor network that's just for Southern California or just for Salt Lake City, or, that's really hard to do. And even entire medical systems, I mean, maybe broad healthcare things, but really specialized biomedical devices or things like that. Angel MD and this larger network of partners really becomes a huge asset, because you can tap into those specialists. And like Joseph brought up in the chat window, timing is also a big thing, right? Sometimes doctors just don't have the time. Even the nurse practitioner can't come on board because there's just not time based on, whatever's going on. And so it's that availability and matching. It's like anything, it's a numbers game then at that point. You need a bench that you can go to, and if one player can't step up, you got to have others that you can step into and ask them to come give a hand.
Got it. Thanks. Kate, let me play a little bit off of what David just pointed out. And I'm going to pick on you a little bit, just because as a relatively young program with KidsX, how do you go out and build that mentor network on day one? I mean, obviously you're working in a larger hospital system with Children's of LA, but there's still you're a new brand to them. You're a new group. How do you engage with them on day one?
Yeah, we were actually really lucky with our mentor network, the breadth of people that were interested and engaged in wanting to work with us. Our Chief Innovation Officer, Omkar Kulkarni, he's worked at a few different health systems and been part of Techstars communities and Cedars-Sinai's accelerators and things like that. So he had quite a breadth of network himself. But I think we actually were really lucky, or we had more interest than capacity to offer people roles to mentor and support. So we were really lucky in that realm. We also, something that we did last year and that we did for the Amazon program and that we also plan to do this year is we try to do really robust needs assessments from our startups. So we actually connect them with people that have the relevant expertise to speak. I can't remember who said this earlier, but the mentor, David, I think it was you, the mentor roadmap. So it's we're putting people in front of them at the time that they actually need feedback. And then when we're putting together both curriculum and direct coaching, the people that they're working with are actually offering them both connections and advice that is timely and relevant to them. So I think I like to call it a listening tour, but I think that helps us kind of call to the right people. And then we take what we heard from the needs of our groups.
When you say you do a needs, I don't mean to interrupt, but when you say you do a needs assessment, do you have a standardized format that you say? What are you looking at? Or is this based on a long interview with them? How do you establish what their needs are? I mean, they may think they need one thing when in reality you're no. That's to David's point, that's 3 milestones from now. Don't worry about that right now. Let's worry about how we're going to get you there.
Exactly. I'd say nothing is standardized from our approach because we're very iterative right now being new, but the way that we did it last year is both survey style and then informational interview. So gathering and listening. And then I think that's actually where our team, as well as the folks that are in our network, plug in, where they're able to, Katie was one of our mentors. I'm sure she worked with one of our earlier stage startups, Rose, who was just building their new Peds product. And I'm sure there were times where they were trying to explore things too early, and she was like, hey, let's start here. So I think just having openness from the startup side of, being told when to stop or go. And then from our side of saying, okay, it sounds like this is what you're looking for right now, or here's who we could connect you with.
Gotcha. So we have a question in that's been upvoted twice. Here we go. From Neil Ray. Now, Neil is actually going to be presenting radiant oximetry at our Best of Best pitch exhibition tomorrow. He's a company that I've known from early days. Actually, Angel MD was a very early investor in the company. And he wants to know, can you help early stage companies find a clinical champion within the system, or do you expect the company to approach you with one already established? Now, Mike, I know what your answer would be, but even though he doesn't know I'm asking him that, but I'm going to go to Kate and Dave first. So, Kate, do you expect a champion for your company, like a clinical champion, some validation from the outside, or do you go out and find them yourself?
So the way that KidsX is set up is we do have a person that's in charge of kind of finding within their own system who that person would be. But for Neil's specific question, like for example, if the solution was directly related to mental and behavioral health, it'd be helpful if the startup was like, hey, we really think this person would be so beneficial to help us plan through this workflow consideration, or we need their advice on this. But it wouldn't be up to the startup to find it, because you likely wouldn't know, who the department lead or who the person with, political sway in the organization would be. So that would be up to the health system champion to find the right person in a department level. Mike, you can probably speak more to this as well, having that experience. But to answer,
I've heard that Jen has now texted him that question, and he is on. So Jen, tell him go.
Yeah. So we're always going to want to connect you up with a clinical champion. So the hard part when you're outside an organization is, although you can find someone who might be enthusiastic, they may not be in the right position to actually do what you want them to do. They may be overtaxed. They may be not in a decision-making position inside the organization. So what we typically do is when we work with companies, we'll go out and find the clinical champion. We'll talk to the clinical champion, but we also talk to the people they work for, to make sure that the whole hospital is behind the concept of having this person be the one that is going to, go forth and conquer for you. We want to make sure that she has the time in her schedule, that she has the right kind of patients to be part of what you want to do, is good at communicating all those other good things, and she has the support of all of her leadership. And that's a huge issue inside hospital systems, because you can find doctor enthusiastic who may not be the right person for your study.
Understood. Very good. Thanks, Mike. So, you know what? We have to move on to our investor roundtable. This is so much fun. I want to talk with you guys longer. Well, the good news is the Alpha Partners will allow us to do that on a more regular basis. We're going to have more of these roundtables going forward. And one of the pleasures has been meeting all of you guys. And then what's going to be even a greater pleasure is introducing you both all to one another, for those that haven't made those meetings yet.